That drugs you're giving is being given by the doctors and is being administered through the vein, not at the back.
Madam, will you teach me my job? I've been practicing for the past 12 years. I've been giving this job for the past 12 years when I worked in the cancer center. The doctors are busy, unless you don't want to try to attend it, and I will leave you and go.
I don't understand. Get me Dr. Chioma. Ha.
I will leave this child down and go out.
Please, I don't understand what is happening here. Please call the doctor.
Madam, at this point, I think you need to leave.
I
You're
can't
teaching my job now.
Why should I leave? I'm always there whenever they're giving my child the medication. So why would you want me out of here?
I am a registered nurse and I'm a satisfied midwife. You don't teach me my job. Madam, at this point, please excuse
I'm
me.
not leaving.
I want to do my job.
Dr. Smith, sir, Matron, yes, sir. The quarterly assessment result of the nurses is here. And I must say that I'm disappointed at some of the results. How can nurses with BSc not know the normal temperature and blood pressure? Oh no, it's quite unacceptable. I think the nursing system should have a system where they test these nurses in core clinical skills.
It's scary, doctor. I mean, the other day I overheard one of the nurses advising the mother to give her baby ampiclos. The baby had jaundice. I came out from the office immediately. I told her, no, the treatment for jaundice is phototherapy.
Yes.
But she insisted. You know how resolute these mothers can be, especially when the instruction is coming from the nurses. And the one that got me upset, it's the new nurse advising a mother to drop breast milk and the baby's eyes. Baby had eye infection, and it was a heavy altercation. I mean, we had to. I stood my ground and insisted that no, this is totally wrong. But she told me that she's been doing this and that it worked for her. I had to intervene, doctor.
Thank you so very much. That's why we need to continue this quarterly assessment.
Exactly.
It's important. Look at their results. It is important so that we will help them to refresh their memories on basic clinical skills.
Exactly.
You know.
I mean, we have the good ones. I think that should make up for some of this. You know, the other day we had surgery for the triplet delivery. This nurse Sabina, yeah, she helped out, and doctor, I mean, I must recommend her. She knows her equipment, and I feel we should encourage her by promoting her and see how we can also raise her salary.
Dr. Smith.
No, I'm just encouraging a hardworking nurse.
This recommendation, I hope it's not from any hidden agenda. Because sometimes I see the way you look at her whenever she passes. Well, Nurse Sabina is one of our best nurses. But you can't just recommend her for promotion, just her, because every other person has been doing well, including myself.
But I don't know how we moved from the assessment of the nurses and eventually we're talking about increasing pay and promotion.
Ask Dr. Smith that needs something extra, more salary for his girlfriend.
I'm talking about the result of the
result. That's what we're looking at.
And you're busy talking about pay raise. Anyway, as the head nurse, looking at this, I'm not impressed. But you need to find a way to develop a curriculum where we will ensure that every nurse we employ is good, just qualifies, not just because of the certificate. Because my oga will always say, certificate is not Sabificate.
I've been doing my best. The only nurse I have issues with is that one that you employed when I was on leave. She appears to be experienced, but makes a lot of mistakes whenever she's attending to patients. Do you know the last time we had a delivery, she had to turn the baby upside down and kept beating the baby repeatedly for the baby to cry. I had to collect the baby from her and I just ambubagged the baby, and within a second the baby started crying. The worst was that she just stood aside, staring at us. No, I'm scared because I wonder how many babies she would have beaten and given brain injury. My fear now is that she's a senior nurse with years of experience.
Yes.
You know, Metron, one those kind of people, they are difficult to teach
Yeah. All right.
because they've done the wrong thing over and
Who can I
over.
say that?
It's now looking like the good thing because it work doesn't mean that's the way it's supposed to be done.
That's it.
But Dr. Finba, I think you should look into this. Why is she still in the system if she's making such mistakes?
But why am I just hearing this? She's been with us for 6 weeks. Ah, please, Metro, make sure this lady doesn't do anything without your supervision. Doc,
Sir.
I want you to keep an eye on this. Let us not be put into trouble because of this. You know, she shouldn't make this mistake here, please.
Okay, sir.
Okay, sir.
Serious.
Thank you.
Okay, sir.
Hey, 1 week, one wahala in this hospital. That one too say shall be their boy. Person wey born pikin here. I don't know here is Canada access. So. Go to suddenly catch me. You are in winter. I must have been the kind that says I don't know. I can't believe people are here discussing why their patients in the waiting room not being attended to. Are you being serious right now? Sorry, but get to work. Yes, yes. I'm not Juliet. You need to Dr. Finger. Okay, ask for it. Okay, Dr. Finger. I don't want to repeat myself. I said get to work. Need help. That's what you're being paid for, so do it. This can never be me. A doctor will just come down and tell me to get to work. Never. A registered midwife like me, BSc nurse like me, ha. Some patients are supposed to be under me because I am a consultant chief midwife. Does she think I can come to her office and tell her to get to work? I think I need to tell Dr. Finn by this time. All these baby doctors that will just be interrupting somebody like that. You can imagine this one. Hi! Yeah, this one passed me. Oh, well, I'm not here now. Now you are here. Maybe you help us get promotion from the consultant. Sure. You will be nurse consultant, Sabina. You will be doctorate in nursing. Then I will be BSc in nursing. This one sweet me. Oh, hey. Senior nurse, we are behind you. Let me go and do what Dr. Choma said I should go and do before she will start shouting at me. Hey, if you want to become consultant nurse, go and open your own hospital and employ your own doctors. What I know is that skilled nurses don't brag. Nurse Sabina does not brag. They can say I have bad mouth too because I have to say the truth. But you see this work, I know my work. And I work very well with my doctors. What Dr. Choma said is very correct. We should get back to work. We should really get back to work. Meanwhile, consultants nurse that cannot resuscitate babies, that one knows. Thank God I'm not in your age. We'll soon find out.
Madam, how are you and your son?
We are fine. Looks like you're new. I've not seen your face before.
I might be new, but I know my job.
Okay. That's good to know. CMS always employ the best. They've been taking care of my son here. We came for his fifth therapy.
All right, ma, sit down.
Thank you.
Receptionist, please get their folder. Keep it at the observation room. I'll come in once you're done.
Ma, but the doctor had to see them first.
I know. I just want everything to be ready before I call the doctor.
Okay, ma, I will do just that.
I'm tired of calling these baby doctors like I don't know what I'm doing. Especially that Dr. Chioma. Chemotherapy is a very simple routine for cancer patients. I used to give this thing in my former hospital. These people are just making diagnoses to be lazy.
Dr. Choma is in charge. Please can you let her know that we're around.
Alright, okay, ma. Nurse Juliet, please take her to the ward and let me know when you are done. I'll join you too shortly.
Okay, and please get the doctor. People, please.
Nurse Juliet, wait up the nursing station.
Please, where is the doctor?
Madam, she'll be here shortly. She told me to go ahead.
Where is Dr. Chioma? What are you trying to
You
do?
didn't know.
That drugs you're giving is being given by the doctors and it's being administered through the vein, not at the back.
Madam, will you teach me my job? I've been practicing for the past 12 years. I've been giving this job for the past 12 years when I worked in the cancer center. The doctors are busy, unless you don't want to try to attend them to. And I will leave you and go.
I don't understand. Get me Dr. Chioma. Oh. Ha.
I will leave this child down and go out.
Please, I don't understand what is happening here. Please call the doctor.
Madam, at this point, I think you need to leave.
I
You're
can't
teaching me my job now.
Why should I leave? I'm always there whenever they're giving my child the medication. So why would you walk me out of here?
I am a registered nurse and I'm a satisfied midwife. You don't teach me my job. Madam, at this point, please excuse
I'm not
me.
leaving.
I want to do my job. This is the door. Madam, please use the door.
I'm not leaving.
Excuse me, but let me do my job.
Dr. Chioma. Ah, Maria, it's Maria.
What's this one? Drug that I've been giving for the past 12 years. After shaking, you stand up. Chatting mommy. Why is this one still shaking? Ha.
Dr. Chioma. Dr. Chioma.
Mrs. James, you are here.
Good afternoon, doctor.
Good afternoon. How is your son? I have a good news for you. This is your son's fifth chemotherapy section, and this is the last.
Wow.
Because the test result shows that all cancer cells are gone. Really? Yes. So your son is doing amazing. Yes. So where is he?
Please, at the observation room. Doctor has been here for over 30 minutes.
What?
Yes, and one of your nurses insisted in giving him an injection. She was trying to give him an injection from the back.
What?
And I told her not to, and she pushed me out of the room.
He just pushed you out.
Yes.
And she didn't even tell me anything. She didn't even tell me that you're here.
Ha! Hey, Jesus! Oh! Everyone, ha! I'm finished! Hey! God!
No, Samantha, please call me to official and mention this. Tell them to meet me at the observation room immediately. It's urgent. Now!
Hey! God, no! I'm finished! Why is my still shaking? Hey! God!
What is going on here? What is it? What is it? Let me happen. What drugs did you give to this boy?
I only gave him Christine, no. They don't send me Intrateka, which I did.
What? You gave him big Christine Intrateka. Why? Intrateka was for neutralizing.
God, I'm finished.
You give chemo. This big Christine Intrateka will kill you for less than 1 hour. Wait, Jenna, stay with us. Jenna,
This boy is there. This messed has killed this boy.
you just killed this boy. Jenna,
Hey! Hey!
what's your good, my son?
Madam, I was not trying to help. I'm sorry, Madam. Forgive me.
I don't need to call
Please,
you.
I'm sorry.
I told you to call the doctor, but you
I'm sorry, Mama. I was not trying to help. I was not trying to help, Mama.
That nurse's energy was so toxic. Almost full of herself. Hey! Now she has killed a boy that was doing so well. This was supposed to be his last chemotherapy. This lady should not be killed. In fact, life imprisonment and can't possible. Hey, consultant nurse. Hey, God. CMS. One week, one palava. In fact, 1 day, one palava. God, I beg. Hey.
What kind of carelessness is this?
Sasha, Scott, no. No. That's not my hard work. I think God was recovering. This is his last chemotherapy. Okay.
That useless nurse will rot in jail, not just losing her license. What nonsense?
She should not go Scott free. No, it's not possible. Doctor, I thought there was something about that nurse. There was something unusual about her.
Now, Sabi, so you're sweating like this.